I've had patients walk into my clinic who've had 2, sometimes even 3 rotator cuff surgeries, and in every single case, they say the same thing. I did my therapy, I was feeling good, I was released, and about 6 months later, it all came back. So, if that's you, or you know someone that is, today I'm going to show you exactly what happens, why that happens, and what you can do to help break that cycle. Hi, welcome back. I'm Dr. Moss with Moss Rehabilitation Center in Springtown, Texas. I've been treating patients for over 28 years and helping people recover from shoulder injuries, whether that's operative or non-operative. And today I'm here to help kind of close that loop. So if you've been with me from the last video, today I said I was going to show you a couple exercises that really seem to help my patients. And today I'm going to show those to you. So stick around. Now, before I get into the exercises, I need to spend just a couple of minutes on why these specific exercises work. Because if you just do the movements kind of half-heartedly without really understanding the why, then you're not going to get the results. So bear with me, and the context is everything regarding these couple of exercises. So in my last video, I talked about the 3 reasons that shoulder pain keeps coming back, right? One is incomplete rotator cuff activation. In other words, most of the time people stop early when the pain is decreased, and you didn't follow my 5 phases of healing that we have a video that we can review with you. So please click on that link if you're interested. It'll tell you about how we move from pain to performance rehab in those 5 phases. Neglected scapula. The scapula is the foundation or the platform, and if you don't activate those muscles properly, then your shoulder pain is definitely going to return. And third, lifestyle, loading, activities, things that you're doing. So if you don't take that into consideration, then train the rotator cuff and the shoulder properly, then that pain is definitely going to come back. So the exercise I'm about to show you, they are designed to address all 3 of these issues, so in a specific sequence. So the sequence matters. So I'm not going to give you a random list of just shoulder exercises that you've probably tried to get on the internet and look around and find, see what Dr. Google tells you about your shoulder, right? So I'm going to give you a system, and here's how it works. So we're going to start with the foundation, reactivating the muscles that have been asleep, usually due to pain and or disuse. Then we build stability, teaching the shoulder blade and the shoulder blade muscles and the rotator cuff how to work together as a team. Then we add load, progressively challenging the repaired or recovered tissue so that it can handle life again. Most rehab programs, they just go through step 1 or 2. So for us, the 5 phases, phase 1 is working to get you out of pain. Step 2 is really working on your mobility, flexibility, and strength. But if you stop there or your therapist stops there, that's not really taking you all the way through the phases and getting you back to the life that you want. If that's the case, then stick around and we're going to show you what you need to do. The other option is, or thing that happens, is sometimes patients jump from phase 1, which is reducing the pain, all the way into a progressive loading program. And that's not appropriate either, because now you're going to load tissue that hasn't really been primed and ready to do that. So you're skipping steps, and that's the gap they're going to work on closing today. One important note before we begin, these exercises, they're appropriate for people with kind of chronic, non-acute shoulder pain, including post-surgical patients who have been cleared by their surgeon to do exercises. If you're in an acute flare-up, or if you've had surgery in the last 6 weeks, or any of these movements cause sharp stabbing type of pain or make the pain overall worse, then stop and see your healthcare provider. This is an educational video and not a substitution for individual one-on-one care. So the first one is going to be sideline external rotation. This is one of the most underrated rotator cuff exercises that we see patients not doing in the clinic. So I've given this exercises to several patients who have done physical therapy over a number of years, different locations, different therapists, and most of them, one, have either never seen this exercise or they do it incorrectly. So the key here is you're going to lay on your unaffected side. Make sure you support your head and your neck. We don't want to cause neck problems for you. And your affected arm is going to be on top, and you're going to have a very small towel roll underneath your elbow to help support that arm. This provides just a little bit of abduction out to the arm so it doesn't cause a wringing out effect on the rotator cuff muscles. Your elbow is going to be bent at a 90-degree angle, and your forearm is going to rest across your stomach. Now what you're going to do here is keeping that elbow resting on the towel roll. What you're going to do is slowly rotate your arm upward towards the ceiling. You're going to hold for 2 seconds at the top and then slowly lower this back down. The key word is slowly. A lot of times I'll give this to patients and they think they need to do it fast, and they start rotating their body, they start retracting their scapula, they're moving all over the place. It needs to be a slow and controlled activation. The key here is that we don't want to use momentum. That's why you need to do it slow. So what happens is if you use that momentum, then you're bypassing the infraspinatus and the teres minor, which are two of the rotator cuff muscles that are often neglected on the back side or the posterior side of your shoulder. So those are the muscles that we're actually trying to wake up and get to work a little bit better for us. So you want to slow it down. You should feel the burn on the back of the shoulder. So I want you to do 3 sets of 12. And if you feel this in the front of your shoulder, that means your elbow and your arm is starting to drift forward a little bit. Make sure your elbow and your arm is directly at your side, resting on a small rolled up towel. Keep it close to the towel and pinned to your side. So why this works. So external rotation is usually a muscle or a motion that's lost after surgery and injury, and those rotator cuff muscles become very weak and ineffective. So it's also a motion that's critical to keeping the ball centered on the glenoid, which is the ball and socket part of your shoulder joint. So if you don't do that, then those muscles are not going to wake up and they're not going to keep the ball centered where it should. Okay, without this, everything else you do is building a shaky foundation. So that's why this is exercise number 1 to start doing. Exercise number 2, the prone Y. This is scapular foundation. Remember from my last video, I said that the scapula is the foundation or the platform that the rotator cuff muscles work off of. So on this one, you're going to lay face down on a table or bed. You can also, if you have a workout bench, that works great because then you can allow your arms to kind of drop down below and then lift them up. Your arm is going to hang off the edge and you're going to have your thumb pointing up towards the ceiling. From here, you're going to raise your arm forward and slightly out to the side. So you're making a Y shape. If you were to do both arms, it would look like the Y for the YMCA. You're going to lift your arm just a few inches off of the table, hold for 2 seconds, and then lower slowly. No weight to start. We want to just use gravity, moving your arm against gravity. That's going to be enough. You're really going to feel this burning in the back side of the shoulder blade. So we're targeting the lower trapezius muscles, which is one of the most consistently weak muscles that we see in therapy. So when I test patients with chronic shoulder pain, this is almost always one of the weakest muscles that we find. It is the anchor point of the scapula. So without it, the shoulder blade is going to constantly tip forward and upward every time you raise that arm, which is going to cause the ball and socket to get off-centered and cause pain. That's going to cause pinching within what we call the subacromial space, which is the space between kind of the humeral head and the acromion. And the bursa and the tendons live there, and those suckers are going to get pinched, which is going to cause pain. So on this one, we're going to do 2 sets of 10. The motion should feel like you're squeezing your shoulder blades kind of down and back into your pockets. So I say that down and back into the pocket, and it should feel like you're squeezing those muscles, not just swinging your arm up and down. If you're working your left side, that scapula gets pulled down and back towards the lower right pocket. If you're working the right side, the right scapula gets pulled down and back towards the left pocket. So it works on a diagonal. Phase 2, stability. So we want to now teach the rotator cuff and the shoulder blade muscles to work together. So on this one, exercise number 3 is what we call a banded pull apart. So on this one, you're going to hold a resistance band in both hands in front of you, your arms straight at shoulder height, palms facing down, and you're going to pull the band apart. You're going to stretch it across your chest until your arms are wide open. So you're pulling across this direction here. You're going to squeeze your shoulder blades together. At the end, you're going to hold for 1 second and slowly return. So this is not a true back exercise. If done correctly, it's a scapular retraction. So squeezing the shoulder blades back, and depression. So you're squeezing the shoulder blades back and down, teaching your mid and your lower trapezius to fire in sync with your rotator cuff. So every time you raise your arm in life, your shoulder blade is supposed to rotate up to help and stabilize, and this exercise helps to train that pattern. I want you to do 3 sets of 15. So the mistake that I constantly see is people, they tend to shrug, they bring their shoulders up as they pull, the shoulders should actually drop. They should stay down and drop slightly as the band comes apart as you pull. If they're raising or you're shrugging too much, that means the band or the resistance is too heavy. Use something a little bit lighter. So we always start with one of the lightest bands, which is yellow, and then progress from there. Exercise number 4, wall slides. So you're going to stand facing a wall. You're going to place both forearms against the wall, elbows at a 90-degree angle, and like a goalpost position, now keeping the forearms in contact with the wall the entire time. You're going to slowly slide your arms up overhead, then back down. So this is working the serratus anterior and scapular motion in an upward rotation type of drill. The serratus anterior is the muscle that's on the side of your rib cage and attaches onto your scapula, and it helps to protract or bring the scapula forward and helps to upwardly rotate the shoulder blade. So when it's weak or inhibited, and it most always is after a shoulder injury and in most patients in general, the shoulder blade starts to wing out to the side and it starts to wing away from the rib cage, especially during those overhead movements. And the rotator cuff and bursa is going to get pinched every single time. So on this one, it's a little bit harder. It's a bit of a challenge. So I want you to do 2 sets of 10. Move only as high as you can while keeping the forearms in contact with the wall. And if your arms feel like they're peeling away from the wall before they reach overhead, then that's your cue to stop. That's your current limit or your ceiling there, and work up from there. Exercise number 5, sideline forward flexion. So you're going to lay on your unaffected side again. Your affected arm is resting along the side of your body and your hip. Your thumb is pointing up and forward and without shrugging. So I'm going to say it again, don't shrug your shoulder blades. You're going to slowly raise your arm out in front of your body about 60 degrees, hold for 1 second, and then slowly lower. So this is a controlled flexion in a gravity-reduced position. Most patients, they've been doing this exercise in standing, and when they do, they're shrugging and elevating their shoulders and compensating. They're compensating when they do that, and they're hiking their shoulder blade, and they're using the upper trap. This position's great because it helps to eliminate that compensation. It forces a clean rotator cuff and deltoid coactivation. On this one, I want you to do 2 sets of 12. Once this feels smooth and pain-free, progress to standing with your arm at your side. Same slow movement, no shrugging activation. Now we're on to phase 3, this progressive loading. So for us, as we're moving in from phases 2 and phases 3 in our 5 phases of healing, as we're adding this progressive load, this is one of the key steps that a lot of people miss out on. So here, we're working to build tissue resilience so the shoulder can handle real life. So phase 3 is where you prove that the shoulder is safe and strong and can be strong again. So this is, again, where most rehab phases start to drop off. The patient feels better, they have less pain, they feel like the motion's there, but they don't have this progressive strengthening, this progressive loading on the shoulder, and they typically say, I'm good, and they leave. That's why we see them back months down the road. When they get back into real life, the shoulder hasn't been adequately loaded and strengthened, the pain comes back. So this is the phase that's actually going to help separate people who fully recover from the people who live in constant low-grade pain and restriction. We're going to do it carefully, we're going to do it progressively, but we're going to do it. Exercise 6, dumbbell sideline external rotation. So this is the same as exercise number 1, but now we're starting to use a very low resistance, low load dumbbell, 1, maybe 2 pounds. Okay, in the clinic, the 2-pounder is pink. It's kind of embarrassing. Nobody wants to do, especially guys, they don't want to use a pink dumbbell, so they want to try to jump ahead. However, you have to do the progressive loading. You have to take your reps through the progression. Otherwise, if you try to jump ahead, you're going to irritate the tissue and you're going to do the exercise wrong, and then you're going to set yourself back. So a very, very light dumbbell. The motion is identical, laying on your side with the towel roll under the side, using that very light dumbbell. Okay, so the goal over that 6 to 8 week period is progressive from, sometimes maybe a half pound, 1 pound up to 4 to 5 pounds. Again, slow, very controlled motion. Okay, the pace may feel very slow, sometimes frustrating. Again, we're building motor control and we're building strength and we're building resilience within the tendons. Okay, so the rotator cuff tendons are going to adapt over time, and it's measured in weeks, not in days. So patience here is not passive, it's the strategy. Okay, 3 sets of 12 for this exercise. Exercise 7. This is a fun one. So you're going to anchor a band down low, close to your ankle height, and you're going to have it on your unaffected side. So if your right side is affected, the band is going to be down low next to the left ankle. So you're going to stand sideways to the band and the anchor. You're going to grab it with both hands, and you're going to pull diagonally across your body, going from that low to the high position. Okay? You're going to try to finish with your hands above the opposite shoulder with the slow and controlled return. So this is a functional rotational type movement that integrates everything we've been after: the rotator cuff, the scapular stabilizers, and your core. Okay, your core is essential as well. So the shoulder doesn't work in isolation in real life, and your rehab shouldn't either. So this movement is going to help mimic reaching, carrying, putting things up onto a shelf, the things you actually need to do in life. So 3 sets of 10. Keep your elbows slightly soft. In other words, you don't have to lock them out fully. The motion comes from rotation through the trunk, and your arms are going to follow. If you feel pain during this activity, don't go either as high or change the resistance level. And make sure you're doing it in a slow and controlled movement. Okay, that was a lot. All right, so here's the summary for the program. You can take a little screenshot, or maybe we'll have a little PDF put together for you at the end of this whole thing. So phase 1, we're going to go weeks 1 to 3. Your focus is on the sideline external rotation without any weight to really prime and activate that posterior part of the rotator cuff, the muscles on the back of your shoulder, and also the prone Y exercise. I want you to do those every day. No weight, master the movement, okay? Now, phases 2, working from weeks 3 to week 6, we're going to add the banded pull apart that we did, and we're going to add in the wall slide. Again, every other day on these, focus on the scapular control. Phases 3, which is weeks 6 through 16. Now we're going to add the loaded external rotation and that diagonal chopping exercise that we talked about. So you're going to do that three days per week, and you're going to progress the load every 2 weeks or so, as long as it's pain-free. So the guideline on all the phases is if you have more than just mild discomfort within the shoulder, I want you to either reduce the resistance or reduce the range of, or the resistance or the range of motion, right? So you have to back down on one of those parameters. If you have pain that persists more than 24 hours, then we're going a little bit too fast. So we definitely need to make sure we're pulling back on either the frequency or how much weight you're trying to lift. And otherwise, you can just keep going. Listen to your shoulder. It's going to tell you. It's your body. You know, especially if you're watching this video because you've had chronic pain and you're not getting well the way you think you should, you're going to have to take it slow. Persistence, but you're going to have to be slow and patient with everything. Okay, so I just want to close with something that I tell every patient that I sit down with after years of struggling with shoulder pain. The shoulder didn't fail you. The program failed you. The shoulder is remarkable. Okay, it will respond to the correct input, and that's what we're going to give you. That's what we give you today. The shoulder will want to heal. Okay, what it needs is this correct stimulus applied at the right time and in the right sequence. So if you've had 1 surgery, 2 surgeries, 3 surgeries, your shoulder can still get stronger. However, it's going to take time. Okay, it has to become more stable, and those muscles have to get activated first before you can get to that end point. You can still regain function and independence, which is the key. I have watched it happen hundreds of times over my 28 years for people that follow the program and stay patient with it. They get the results that they want. So work this program for 12 weeks consistently. Be patient without skipping the phases. Listen to what I'm telling you. Use my experience as a guide. Okay, and I'm confident that you're going to feel the difference. So if you found this helpful, please share it with someone who's been suffering with shoulder pain for years. They might be one video away from the piece that they've been missing, and to help them improve and become independent with a pain-free shoulder. So please make sure that you subscribe for more information. Drop a comment below. Let me know what you've been struggling with, what exercise surprised you the most. I'll read every one of them, and I'll try to respond to those comments as quickly as I can. I'll see you in the next video. Thanks.